Welcome to Consumers Doctor. On the behalf of Foremost Organization, we welcome you all to this Consumers Doctor. This is an insurance segment focusing on health insurance privatized, so-called HIP. Health insurance personalized, not privatized. Health insurance is personalized. How do you develop a national consensus? So today's topic is developing a national consensus. That'll be an interesting thing to talk about because it really needs attention, interest, and action. Yes. Real change requires a real change. Real change. Of all the stakeholders, the consumers must be in the front and center. Remember, the most access to affordable health insurance starts with affordable health insurance. It has to be affordable to all Americans, irrespective of the socioeconomic status, irrespective of the health status, irrespective of no matter whatsoever. I would rather have a personalized health insurance for all instead of having this bronze, silver, gold. Folks, that's not acceptable. We don't like this class system. We don't want a class. We want all Americans to be given a health care at the same level. It has to be personalized. Advocating for personalized health insurance will require consumers change for a passive interest to a demanding position, demanding action. Get politically active and personally aware of your ability to make a difference, Here are some ideas which we will talk about. This is as per Ron Bachman. We talked about Ron Bachman, who has been an actuarial for the last 50 years. He has been in front of the Congress. He has worked with both Democrats and Republicans alike. I'm only a messenger, folks. I'm only a messenger. As a consumer's doctor, my obligation is to give you the experienced professionals, what they taught us, and how consumers can demand for this. So here are some ideas what we suggest. Number one, write your congressmen, senators, and other elected officials. Ask elected officials to form and participate health insurance reform task force. That's number one. Number two, write op-eds to your local and national papers. Yes. And number three, be a guest or a caller on a local, regional, national talk radio like myself. I want to encourage all the consumers to do the same, all the Americans to do the same. And number four, respond to articles and posts on the social media. Don't be silent. You have to respond. And number five, contact your human resource department and request for more consumer-driven, patient-centric options. You have to demand it, folks. You really have to demand it. And number six, make additions to your health savings account a priority. You have to. And number seven, understand and meet the standards for your company's rewards and incentives. You have to look into your company where you are at. You need to look at all the options. And number eight, lower your personal unnecessary utilization of medical services, which this is where the healthcare segment, which is a separate channel from, as a consumer's doctor, I try to give all the tools necessary for all the consumers so that they can lower their utilization for medical services. That will help. Like, health gives wealth. Health is platinum. That's what the segment is all about, health. It's all in your mobile phone. Your information is knowledge. Information is power. Information saves money, gives you financial independence. Number 8, actually, we talked about lower utilization. And number 9, your biometrics. Know and control your biometrics. This is where the healthcare segment, so-called consumers doctors, gives you a healthcare segment, and he has podcasts. He gives you some tips and tools, what consumers need. Your blood pressure, your cholesterol, your body mass index, and your waist size, your A1C level, all needs to be at your fingertips. You have to keep it in your notebook on your mobile phone. Keep your health records. We talked about health records. You need to have your health records right on your mobile phone, right on your mobile phone. It should be available when you go to see a doctor. You should be able to transfer your personal information, your history, your family history, your background, all that should be on your fingertips, on your mobile phone. And last but not the least, number 10, don't smoke, don't do illegal drugs, and don't abuse alcohol. We all, as youngsters, we have all gone through that, but as you mature, I'm sure people will realize health gives wealth segment, health is platinum segment will tell you on the personal health. Health is wealth. This is an asset. You need to take care of your asset. I've been emphasizing that. When the politician and media say there's no alternative to government control, don't listen to this Medicare for all, single payer folks. You need to respond loudly. Says we need freedom from these shackles. We need freedom. You want to see my doctor. You want to see your own. You want to go. You have to have a choice. This is very important, guys. A lot of people, just take it lightly. We already have a government intrusion into our private lives. They tell you, this COVID-19, look at what we are going through. They tell you what to do. I don't like it. We are personally responsible. Government can make you aware, but they cannot enforce and rule things. They want you to shut down everything. You can't do. We are not in a communist country, man. We are personally responsible. American people, Americans in general, they know their health. They know their limitations. You can give them the guidelines. Let Americans take care of themselves. This pandemic has brought too much attention onto our personal responsibility. I think we need, Americans in general are personally responsible. They're mad with every time somebody tells them, shut down your, they have to make a living. You cannot, now California is on lockdown for next 3 weeks. All these small and mom and pop places, restaurants are shut down. How do we survive? How do we survive? This is where we need to, this is where we have, when it comes to voting, this is show your power. What do you mean? You get what you pay for. When you don't choose, this mail-in ballots has been a disaster. So I don't know where, ideally you should have, accountability in elections, and this mail-in ballots, especially in these pandemics, has created a mess in our political system, folks. I hope we can come to an agreement, agree upon, and a common understanding. American democracy at stake, man. American democracy. Ultimately, all stakeholders need to gain from legislation. A strategy for developing a buying healthcare industry is to establish a healthcare consensus, addressing most pressing needs for each stakeholder, for all Americans. Legislation must meet their needs. This is what we need to demand it from our political representatives, so-called. We are electing them. We are sending them to Washington. They need to be accountable. And you need to demand them to function in a new, more effective, consumer-directed, patient-centric system, folks. We need to demand that consumer-driven, patient-centric system. It'll not be easy, folks. Nobody's saying it's easy. With its flaws, some stakeholders are benefiting from Obamacare. They're called freeloaders. Freeloaders. They want to maintain the status quo. They want to keep the status quo. So they are getting the free care. Man, there's no free care. Ultimately, you'll pay for it. And we don't have the money. We have no money. We have $25 trillion in debt. And we want, where is this? Who's going to, somebody, even if you tax the rich, folks, top 1% of the rich, we're not going to get, the government cannot handle what they have. They cannot provide what we demand. Politicians make a lot of promises, but we as consumers ultimately have to decide. Our representatives demand them what we need. We need consumer-driven, patient-centric system, and we need lower premiums. And it has to be affordable. And we need a certificate of guaranteed coverage. Who need the most? We can do that through public-private partnership, man. Public-private partnerships is the way to go. We always have done that. We always, all political leaders have embraced the public-private partnership. This is where taxing the wealthy is not going to solve the problem, folks. It's not going to solve the problem. Remember, with no concessions in the free market solution, basically what happened is, with no concession in the free market healthcare solutions, Obamacare upended the entire insurance market and forced 200 million Americans into government control programs. And President-elect Biden wants to do the same with new taxes, burdensome laws, rules, and regulations. We can't take it. Look at what they're doing to our pandemics. They want us to, shut down completely. We can't do that. Give Americans what they need. Give them the tools. We're not asking. Give them the tools what they need. Don't mandate it. Don't more government regulations. It costs more. Government overreach can cost a lot more. We don't have the money to cost for these rules and regulations. Consumers could not keep their doctors or their insurance policies because under the Obamacare, basically they were forced to buy coverages that government thought they needed or faced financial penalties. That's what the Obamacare did, financial penalties. Ultimately, it has been defeated, but we're still a long way ahead, folks. We are still a long way. Politicians basically exploited the failures of the old insurance system to pass and implement an Obamacare, which is a tragedy, folks. They exploited the free insurance market's weakness. First of all, insurance companies had a general risk pool instead of segmenting it. Insurance companies need to be blamed for that because they have these lobbies in Washington, and they need to be blamed because what politicians are doing, they're taking the opportunity of failed market conditions to force upon us the so-called Obamacare. And these Republicans failed to offer and coalesce around the alternatives of health insurance personalized concept. They have failed. Even Republicans have not, Paul Allen, when he had the Congress, the Senate, and the presidency, he failed. He basically failed. They never did what they were supposed to do. And some of the Republicans need to be blamed because it's hard to, politicians, representatives in Washington, they need to realize consumers' demands have to be met. This personalized health insurance is a solution. It's ready to go today, man. But they don't want to talk about it. They don't want to even look into it. They don't want to even see by segmenting the risk, putting the consumers in the front line, Americans in the front line, giving them the freedom. They deserve it, man. They deserve it. Earlier, the private markets have failed. They have failed us. That doesn't mean that we can look into this personalized health care approach. Right now, as we see it, personalized healthcare solutions are ready to go. I have explained in detail how it can be. Number one is segmentation of the risks rather than these insurance lobbyists are fighting tooth and nail against segmentation because that lowers the premium. Segment the risk into 4 categories: well category, at-risk category, chronic illness category, and catastrophic. By segmenting, you're basically lowering the premiums, and consumers can shop for lower premiums like any other home insurance policy, auto insurance. We need to give the consumers the tools what they need. Personalized health insurance provides an option for more affordable insurance, guarantees the coverage for pre-existing conditions, and gives the choices to the remaining 27 million so-called uninsured. Those numbers are not right. Actually, 27 million is too high. There are actually people who really need the most. We are not providing. Even on these uninsured people, they need to be focused. Uninsurable folks, uninsured Americans need to be focused, and they should be given certificate of guaranteed coverage. Who need the most? If they are not economically stable or economically impaired, we need to give them the tools and give them the certificate of guaranteed coverage rather than putting the burden on these hospitals and providers and giving them this Medicaid, which is not helping. Basically, you're ignoring it. Most of the providers don't take it. Hospitals lose money on Medicaid. We need to change that into a personalized and health insurance with a low-cost options, certificates under the Health Review Board, which ultimately, we've talked about Health Review Board. Health Review Board is a public-private partnership which regulates the insurance companies. They need to be accountable to the Health Review Board. And the consumers will be in the driver's seat. They can shop for the health care, health premium, what they need. Personalized health insurance is a free market solution. Don't look at the old free markets. We have failed in that because this is a system which will work, and it empowers the consumers and both individual and small employer sponsored group insurance. I will keep harping on HIP. HIP, HIP is health insurance personalized, folks. HIP on the healthcare side, health gives wealth, so-called health is platinum, which is HIP. There are two segments, folks. Follow me. As a consumers doctor on the behalf of the foremost organization, I'll continue to deliver these two segments. One's in the finance segment, so-called health insurance personalized HIP, whereas healthcare segment is so-called health is platinum. Health is wealth. Health gives wealth. Folks, if you do like this, subscribe, share, and touch that bell. Thank you. Thank you for listening. Thank you for spending time. I love you guys. Thank you all. God bless.